The nation may recall that I made a policy pronouncement on HIV test and treat to enable many people start treatment for HIV immediately they know their HIV positive status in order to remain healthy and productive. With more people in treatment, we'll have less new HIV infections and we'll end AIDS in Zambia.
As the mother of the nation and member of the Organization of African First Ladies for Development, I am committed to supporting the Zambian government and its people to end AIDS as a public health challenge by 2030. We must stop new HIV infections in children and keep their mothers alive, which is the main objective of the Free to Shine campaign.
But today, I think people take it lightly because I've heard someone talk this way actually. They'll say, today AIDS is not as bad as it used to be because people are living healthy. They'll look healthy. They're still drinking, they live their normal life. Everybody's thinking, okay, HIV today is not as bad as it used to be, and they just choose to live life.
I remember realizing that my situation, somebody was going through it. And I just needed to speak out. Main reason of coming out was to reach out to somebody who was in the situation of thinking that they have no future, there is no hope. How much courage I have. It's not courage, but it's about just, if I can do it, if I can talk about this, then you will.
I know everything about being HIV positive and I have to take care of myself. Chikondi is an awesome baby. Despite he likes crying. He likes crying and the difficulty in eating. But I'm trying my best as a mother to do all I can, to make him healthy.
The new infections which we continue seeing, especially in our country, are largely in the men below the age of 35 and also in the young people. The young people, it includes both women and the men. So the young adolescent women and girls, those below the age of 25, we are still seeing new infections. And also those that are positive and are in this bracket, we also need to identify them and put them on treatment. The risk of transmission, it will be reduced. What we are talking about, we need to start with testing. So if we can have individuals tested, as many as possible they are tested, they know their status, then it would be easy for us to apply these prevention models. If someone knows that they are HIV negative, then we provide those aspects which are needed for them to prevent acquisition of HIV. Those that are positive, they need to be started on treatment, and they need to start treatment immediately. There's no room for waiting. And information is very key, so we need to empower both genders on the importance of knowing the status of your partner, and if they're on treatment, are they detectable or undetectable, because there's an implication of transmission. The Zambia Ending AIDS campaign is important because we are reaching what some people may call the last mile. Because we are talking of ending AIDS, we have to refocus ourselves in the programming and also in our thinking is how do we prevent new infections? So the Zambia Ending AIDS campaign has come at a critical time in that Zambia is on track. Possibly next year, we should be able to say we have achieved HIV epidemic control, where we have less new infections compared to less deaths.
Brought to you by the Ministry of Health and the National AIDS Council, with the support of the American people through the United States Agency for International Development, USAID, and the United States President's Emergency Plan for AIDS Relief, PEPFAR.